Welcome to This Explainer. Today, we're tearing down the NHS Safety Mirage and exposing the bureaucratic spin.
Seriously? What happens when a national health service just stops tracking if its patients are actually safe?
They brag about saving £1 billion, but notice what's totally missing: actual patient safety tracking. We call this the paper shield. Politicians use shiny bureaucratic data to totally hide on-the-ground clinical failures.
Check out this official admission. There is literally zero formal mechanism to systematically track patient safety. Wild, right?
So, how do they dodge accountability? Through a sneaky little tactic known as So, how do they dodge accountability? Through a sneaky little tactic known as governance by delegation. By abolishing oversight and pushing budgets to vague local groups, the government quietly fragments its legal duty. Partnership is just a euphemism here. When care fails, absolutely nobody is left holding the bag. Look at this liability loop. Complex patients just bounce between administrative silos until they hit a brick wall. Vulnerable patients become hot potatoes. They're left entirely unowned, forced to coordinate their own survival during a crisis. The human cost? Devastating. Just look at this massive 37% spike in youth self-harm admissions. And our frontline staff? They suffer deep moral distress, carrying the crushing weight of a structurally broken system. So we gotta ask, is this just bad management or a totally deliberate evasion of public responsibility? Here's the kicker. The 2022 Act proves the government already has explicit legal power to intervene. To fix this mess, we absolutely must demand answers to these 4 foundational steps of accountability. The law is crystal clear, folks. The NHS is a national service. The duty of care definitely exists. If politicians hold the legal levers right now, why hide behind a paper shield of bureaucratic success reports? The ultimate scandal? Legal responsibility already exists, yet this immense human suffering is just allowed to continue. So, what's it going to take to finally tear down this safety mirage and start legally protecting human lives?